everybody into the room now. My presentation today is called For the Benefit of Others, Training the Mind for Psychotherapy. Where I come from Naropa University. I'm a master's student there in transpersonal counseling psychology. It's incorporated, mindfulness and meditation training are incorporated into the training of clinicians at Naropa University. So I'm going to be talking a bit about how that's done at Naropa today, and also maybe the benefits to our clients of our own practice. So that's pretty much an overview of what my presentation is going to be about, in short. And I'll be wearing different hats today, and I'll tell you about this as we go along. The first, which I just wore, was my role as a mindfulness instructor, Naropa University mindfulness instructor. And so you can go ahead now. So a little bit about Naropa University. It was started by Chogyam Trungpa Rinpoche. Who here knows who Chogyam Trungpa Rinpoche is? Okay, so a number of you. And
I'm sorry, if you could just talk a little louder to make sure that the camera picks it up.
Sure, no problem. Trungpa Rinpoche, for those of you that don't know, came to the West in 1970 and very quickly established a reputation of being an unconventional teacher, being willing to do anything to help his students wake up. And in 1974, one of the ways was to start Naropa University. And here's one of his students who is talking about the premise behind Naropa University, Marvin Casper, and he was also the director of the Contemplative Psychotherapy program, which is one of the graduate programs, in addition to the one in which I study at Naropa. It says the basic idea was an institute that would create an interface, a dialogue between Buddhism and the intellectual culture of the West. Rinpoche talked about creating sparks by juxtaposing different traditions. Skipping a sentence. If people from different traditions challenge and compare their approaches, they could go beyond conceptual mind to new perspectives. So particularly note this last sentence here. It'll be relevant to the presentation this evening. And a little bit about how Naropa got its name. Naropa was a Buddhist teacher in the 10th century, but originally was a scholar. And he was a renowned scholar at Nalanda University in India, and studied epistemology, logic, philosophy. And then one day, as the story goes, a female deity appears to Naropa and says to him, "Do you understand the words of the Buddha?" And Naropa says, "Why, yes, I do." And she appears very happy. And then he says, "And I understand their meaning." At which time she goes on to convince him that he actually does not understand the meaning behind the words. He just understands the words. And such as Naropa University is incorporating practice and study. So it's not just about being a scholar, but it's also about being a practitioner. The mindful orientation to therapy is often delineated into these three categories. Mindfulness-based approaches, so these range from explicit to implicit influence of mindfulness or incorporation of mindfulness into therapies. So the mindfulness-based approaches where there's an explicit teaching of mindfulness within the session. And then this mindfulness-informed approaches, and then mindful presence of the clinician. And this category will be our main focus this evening, which is the implicit influence of the therapist on their clients, their own mindfulness practice. How does that impact the therapy? Of course, a combination between these three is probably what you're most likely to find, and probably the most beneficial, but we'll be focusing mainly on the third this evening. Before we go there, just a little bit about Buddhism and science, the similarities and differences between them. In addition to being a master's student, I'm also the graduate research assistant in the Naropa University Consciousness Laboratory. And we often have this discussion in the lab, the similarities and differences between Buddhism and science. So starting with the similarities, when I say we, I mean obviously the other students who are volunteering in the lab and working there, but also Dr. Peter Grossenbacher, who is the director of the Consciousness Laboratory there. So the similarities and empirical priority, so this emphasis of data over theory. So both in Buddhism and science, you have this emphasis to varying degrees and in different ways, but in Buddhism, this idea is that you try on a concept try on a teaching, see if it fits within your own experience, and if it doesn't fit, you go with the actual experience. You prioritize the experience over the concept. Concept is seen as secondary. Similarly, in science, if you run a study and the data doesn't accord with the theory, you throw the theory out, you go with the data. Also, in their methods of observation, there's a balance of open-mindedness and skepticism. As Dr. Grossenbacher writes, how can we truly be open-minded if we're unwilling to be skeptical of our own thoughts? It's kind of like a bumper sticker. I don't know if you guys have seen this, but it's don't believe everything you think. I really like that. And then also the value of being of benefit. Both Buddhism and science share this value in different ways. They go about it in different ways perhaps, but both interested in helping to solve the world's problems, helping to relieve suffering. That brings us to the differences. The mode of observation being the primary one, first person versus third person. First person being more phenomenological, third person more like a detached witness trying to separate subjectivity from objective facts. And that creates an internal versus external orientation difference between the two traditions in terms of how they go about solving problems. And so Buddhism, it's about developing oneself from the inside out to be of benefit, whereas in science it's often about manipulating the outer world, different things in the outer world to try and solve problems, such as creating new technologies, etc. So the first and second turning of contemplative research. Some of you may be familiar with these terms in Buddhism, and I'm just drawing a parallel to what I see happening in the field, or what I'd like to see happen within the field. The first turning and second turning in Buddhism, the first turning is this focus on practicing meditation, and I'm oversimplifying here perhaps, but bear with me. First turning is practicing meditation for the sake of oneself. What can meditation do for me? How can meditation help me relieve my own suffering? And the second turning, sometimes called the Mahayana, is focused on how can my own practice help me help others. And so the practice is intended primarily to be for the sake of others. And so the first turning of contemplative research, as I'm calling it, is just that, focusing on studies the impact of mindfulness or meditation on the one who's practicing it. So valid topics of research: mindfulness and well-being, the brain activation or structural changes of the brain due to one's own practice. And there's a clinical focus on facilitating the client's own practice. So we know the benefits to someone who's meditating, so we're going to teach the client mindfulness. And the second turning, there's little research in this second category, but I think increasingly we're going to see it. The focus being on practicing mindfulness for the sake of other people. The research to be focused on the interpersonal effects of meditation training. And the clinical emphasis would not just be on facilitating the client's meditation practice, but also on the clinician's practice as well. And so in the first turning, you could really, if you just read the research, you could really get into this kind of paradigm of, okay, I'm going to practice meditation so that I have a thicker cortex, or something like this. And in the second turning, the idea is, well, now I can have motivation to practice because I know the data is showing perhaps that it's beneficial to other people as well. So you could create that kind of aspiration just from reading scientific research. So again, this is just my thinking, and take it with a grain of salt, but I might be referring this evening to the first and second turning.